We have Dr. Kelly Scherger and Kathy Therber with us today, and they're going to share their experiences in the clinical setting, but also as a cancer survivor using mindfulness for stress relief. Before we get started with the session, I always like to talk about the why we do these sessions and what is the After Cancer and why we're here. So the After Cancer is a platform for cancer survivors. We enable organizations to create their own survivorship programs, merging their clinical know-how with our technology. And our goal is really to give evidence-based and safe information and tools to cancer survivors within our digital platform. We know that our platform takes and improves, patient outcomes, and it's really that touch points in between visits for patients. Um, we have a group of different types of cancer within the platform at the moment, and the things they usually share is how we help them navigate post-cancer care, and how we just give them confidence and the support that they need in between visits. Mindfulness is a big thing that we do within the After Cancer. Kathy is one of our therapists. We have weekly sessions, we have recordings, we have educational content. And so we thought it would be a great way of sharing all of the learnings that we have and all of the tools that we have by running this session. So let's get started because I know you didn't come here to hear about me. You came here to learn about Kelly and Kathy's work. Kelly, over to you. Can you introduce yourself, please, and tell us what do you do?
Absolutely. So, hello, everyone. My name is Dr. Kelly Scherger. I'm a clinical health psychologist, and I have many years of experience working in psycho-oncology in the Charlotte area. And mindfulness is an essential part of my practice as a clinical psychologist, working with both cancer patients and survivors, and then also anyone else. So I also am a sex therapist, so I also use mindfulness a lot when it comes to sexual health and wellness as well.
Wonderful. Thank you. Kathy, over to you. Tell us who you are and your work.
Hey, I am Kathy Therber. I've been teaching yoga and mindfulness for 30 years now. I work mostly with cancer patients. I've also worked at the VA as well as the hospital for VA veterans as well. Um, I'm a cancer survivor. 10 years ago, I was misdiagnosed. I was told I did not have cancer, and a year went by and it had turned into a stage 3C breast cancer. So I went through chemo, radiation, surgery, as well as hormone therapy. So I was a teacher before and after my treatment, and I continue to this day to provide the tools of mindfulness, meditation, guided imagery, and such.
Thank you. I would love to start and learn how did you learn about mindfulness and meditation, and how did you have that first interaction? So Kelly, tell us about you.
Absolutely. So I was thinking about this when I first was exposed to mindfulness, and it was actually through yoga practice. And I was never someone who was hardcore into yoga, but kind of dabbled in it. And I was thinking of this one instance where I used to live in Boston. It was a very busy studio, and there was some kind of banging going on during Shavasana at the end of the practice. And I remember being so irritated. And something that the teacher said really stuck with me. And it was just kind of, letting the noise be there and listening to the noise and kind of attending to it instead of pretending like it wasn't there. And I think that was my first like real experience of being like, oh, I can actually think about things differently. And I don't have to, let these things affect me in this way. And then in my doctoral training, I obviously got a lot more experience with mindfulness, doing mindfulness, practicing mindfulness, and then also teaching mindfulness. And I also remember when I was very new to it thinking, oh my gosh, I'm so bad at this. It's really hard for me to not let my mind wander. And with a lot of practice, I've learned that that's very normal and that's part of the practice. And the reorienting when you realize your mind has strayed is an essential part of the practice. And so having your mind wander is kind of the sign of a healthy brain. And that's a lot of times how I describe it. And that's a lot of times how I also explain to other people, when I first started, I thought, wow, I'm really bad at this. But that's the point, is that, we're not bad at it. It's just that's how our minds work. And so kind of learning to work with that gives you kind of a lot more freedom and space and kind of opens you up to more possibilities. So I think mostly through my own practice, I have learned much more about mindfulness and the benefits of mindfulness as well.
Thank you. I love how you discovered it through yoga. I think that's very common. It was the same with me. Kathy, tell us about how you learned about mindfulness and started practicing it.
Yeah, similar. I started to learn in yoga and branched off or forked off to mindfulness, the guided relaxation, the breathing techniques, um, all the yoga nidra, all of those tools and experiences that got me interested in understanding mindfulness. So that was my entrance yoga.
Got it. Thank you. Now,
Yeah.
I would love to hear about mindfulness and cancer survivorship and cancer patients. How did you link it? And what are the benefits of mindfulness for cancer patients? So, Kelly, tell us how you use it in your practice.
Absolutely. So again, I use mindfulness a lot and for a lot of different symptoms or presentations. So there there's also a really interesting meta-analysis I was just looking at recently showing that cancer patients who practice mindfulness, there's some promising results to show that their immune markers look better. So there's something that is going on in the body that, is really healthy and good for us, especially for cancer survivors. And so when it comes to stress, mindfulness is a really great way to help lower the stress level, to help us think about how to respond in stressful situations instead of just reacting. So it helps us just to slow down. And I think another really important component is that mindfulness allows us to be present with the people around us. So I always think about how our world is there's always a lot going on, right? We're always on our phones or, getting texts or emails. We're always doing so many things at once. And mindfulness is the opposite of that. So it is the ability to kind of just be in the moment and not multitask and not have our mind be, a small percentage of everywhere else, but rather 100% here and now. And again, I like to really help people figure out what is it that you want to be doing mindfully and what matters to you. So it helps people really spend their time in a way that they appreciate. I think that's really important. And I think, again, it's really hard with all the distractions in our life to really take a step back and slow down and just be in the here and now. It also really helps people to kind of get in tune with their bodies. So a lot of times with cancer survivors, there's a lot of over interpreting a lot of things that are going on in your body. And mindfulness can really help us to be in tune in a way that is grounded and doesn't exacerbate symptoms, because sometimes our minds can do that. They're very powerful when we kind of hyperfixate on things. So it's just a really great way to get grounded, to have that mind-body connection. And stress management can really help with sleep. That's another one that's really good, is especially for people who say, I have a really hard time turning my mind off at night. Mindfulness can be a really great intervention for helping people fall asleep or sleep better, and just overall can really improve people's quality of life.
Yeah, thank you. Kathy, you've practiced mindfulness in cancer centers, like you taught it, you practice it as a patient. Tell us about your experience with mindfulness and cancer.
Well, speaking of the benefits of mindfulness, people who have cancer or who had cancer might spend a lot of time in the future worrying. They might spend a lot of time in the past feeling loss and grief. So with the mindfulness practice, we collect tools that allow us to be present and aware of what is happening in the moment. That can give the thinking mind a well-deserved break and freedom, potentially even a smidgen of freedom from worry, fear, and regret. So we are able to off-ramp the habitual thought patterns that people are going through that may not be pleasant or are definitely not productive. And we're able to transition into the present moment. So the tools that we collect by practicing mindfulness are beneficial in a practice together or a formal practice, but they also provide the people who practice it with tools that they can practice on their own. So it's not only something we can benefit from in the moment, but we can also learn to self-regulate. And this is extremely beneficial for people who are going through challenging times of uncertainty, people who may be facing death or accepting death, and we're able to come into a place that is real and present with these practices. So, I mean, this has been studied and proven to help with stress reduction. It can help us improve focus. It can help us lower our blood pressure. It can help us for fostering healing. Think parasympathetic nervous system, right? It can ease inflammation and it can improve digestion. It can strengthen our immune system because we're coming out of the fight or flight fear mode. And instead, our body is creating hormones that are actually beneficial and healing. So that helps, like you mentioned, Kelly, better sleep. This is one that I find interesting and encouraging is that people have been studied and they actually find that they have fewer feelings of being lonely and isolated. And cancer can be such an isolating experience, right? You're sidelined. There's also the opportunity to increase self-esteem and mood regulation and resilience. So if you have a resilient mind, you may be more able to go through these hard things that you have to do when you're facing tests, when you're facing information that may or may not define your health. So as that, I mean, that's what I've experienced and that's what I've seen. And I listed things that have actually been studied. And so the one easy way to think about this is what happens when we stimulate our parasympathetic nervous system, right? We are able to shift into a different mode. And these methods help us do that, let alone all the other, let alone the tools that you gain from practicing being aware of your thoughts and managing them.
Yeah, I love how you explained at the beginning how cancer patients spend a lot of time in the past and in the future because you're thinking about who you were before and what's going to happen next. And you're in a phase where you cannot plan or you feel like you cannot plan. And I love how mindfulness can be that tool that brings you to the present moment, to the now, and find some comfort in there because you need to be there and be okay with it and be resilient to whatever might come next. So I love how you put that together.
Well,
Go ahead.
a follow-up thought to that is that when the future, we don't know, right? It doesn't exist. It's not real. The past isn't real either. It's gone. And if you can slip into the present moment, the beauty of that also is that that is real, right? So you can assume that stability of truth.
Yeah, I love that. I would love for both of you to share a story of a patient that with whom you worked, where you where you saw how mindfulness benefited them. Kelly, do you have someone in mind that you could share?
I do have someone in mind. So this was someone I was working with who is a cancer survivor and had a lot of worry and stress. So he had a high stress job, and that certainly contributed. And obviously, his health was a constant worry as a cancer survivor. Um, some fear of recurrence would often come up, especially in those times where he had a lot of work stress or other stress going on in his life. That tends to happen. And so we started to use mindfulness as a way to root him in the present. And as Kathy mentioned, there's so much fear and anxiety about the future that it can be really helpful to reorient focus to the present and not always kind of, we call it, spiraling or catastrophizing about the future. And that was something that he was really good at. So we had to do a lot of practicing mindfulness, both in session and then, of course, for homework. And what I like to do is I like to think of mindfulness as a muscle that we need to kind of, start with those light weights. And then we move on to maybe the bigger weights where we spend more time doing mindfulness. And so we do mindfulness in really small ways first for small periods of time to kind of, dip our toes in. And then it becomes more of a formal practice of, sitting down, taking 5 to 10 minutes every day to practice mindfulness and start to integrate it into your life throughout the day as well. And for this person who was a little skeptical at first, but was willing to try. And throughout our time together during treatment, he got really into mindfulness and really noticed the benefits of how he was able to just have a clearer mind and manage stress better and not be distracted by his, anxious thoughts about his cancer coming back or all the things he has to do at work. And it got to the point too where he learned and did some Tai Chi classes. So he was pairing mindfulness practice with breathing and movement. So he was doing mindfulness in a lot of ways. And one of the things he would say is, I can tell when I haven't been practicing mindfulness. And so he knew he had enough insight to know, okay, it's been a few days or it's been a whole week and I have not done mindfulness, and I can feel it. I can feel it in my body. I can feel it in my anxiety level and my stress level. So that was another component that it really built that self-awareness of giving your body what it needs and checking in with your body too, and making sure that, you are feeding your body and nourishing your body in different ways. So not just what you eat, but also how you spend your time and your focus. And so that was, I think, a really great case that showed that this practice, though kind of simple, was really effective in a lot of ways. And again, he kind of like took it and ran with it and built and did more. So he started with those baby weights of mindfully brushing his teeth, and then went on to more formal practice, and then again went on to adding in some movement. So that was really, really cool to see. That was one of my favorites.
Yeah, and you mentioned something interesting. He was skeptical at first. What are usually the first reaction of patients when you talk about mindfulness?
Honestly, I think sometimes patients think that it's too simple to be helpful, or they think, oh, that's easy. And when I say, I want you to practice this, but I want you to do it often. I'd love for you to do it every day. And they say, oh yeah, that's no big deal. And so I say, well, we're gonna start small. Why don't I'm gonna assume that you're brushing your teeth every day. I want you to mindfully brush your teeth for those 2 minutes that you're brushing your teeth. I don't want you to do anything else. I want you just to attend to the experience of brushing your teeth. What does it sound like? What does it feel like? What does it taste like? What does it smell like? And then inevitably, most people come back and say, that was actually a lot harder than I thought. Something that sounds so simple is actually a lot of kind of mental effort. And so I go into explaining that, we cannot be mindful 100% of the time because that is not efficient for our brains. We are not built that way. And so I think that if someone is skeptical, that's great. I can work with that as long as they're open to trying. And I think that is the one piece that is like my little crack of hope of saying, I know this sounds really simple. I know it doesn't sound earth-shattering, but I want you to try it and we'll just see what happens. And so having that openness is a great way to kind of cut through the skepticism.
Love that. And yeah, brushing your teeth. I think that's maybe the takeaway of this session is everyone. We should all try it, right? Let's brush our teeth mindfully this evening. Kathy, tell us about your experience with introducing mindfulness to patients and maybe a story.
Yeah. When we practice mindfulness, we'll do things like breathing techniques and guided imagery, which involves the five senses, and guided relaxation, gentle movement, as well as becoming aware of thoughts and mindfulness in general. So there's a lot of different ways that people can do this, right? So I'm thinking of one woman in particular, we'll call her Karen. And she noticed that, and this is something that Kelly brought up, is people are perhaps more able to become aware of how they're feeling, their state of mind. That's part of becoming aware and being mindfulness. And she was beginning to notice and see that every time that she got into the car and have her husband drive her to one of her treatments, she started to become very nervous, agitated. Her heart rate went up, all of the stressors becoming very apparent. So she would practice points of contact in the car where she feels the places that her body is touching something and allow her body to become heavy, allow her muscles to relax. And when the body can relax, the mind can too. So she would use this tool on her way to walk through the hospital doors, to go into the escalator, to check in, to end up in treatment, right? Like those are all very big things that you do, right? So she was able to set herself up to calm down, to be present, to acknowledge and love herself with the practice as opposed to forcing herself through something, which works too, believe it. But she was able to partner with herself a little bit more readily to go through something very difficult, right? So that's her. And then there's another woman who would generally use her breathing techniques. We can call her Sally. When she would be going in for her tests. MRI, there's a lot of waiting. There's a lot of sitting in a room behind a closed door and wondering when somebody's going to come and see you. That can be a time of when the anxiety can come up, or it can be a time where you're like, well, I'm just sitting here. So if you could use that time to self-regulate and practice. She would do breathing techniques. She would do extended exhale breathing to stimulate the vagus nerve and allow the parasympathetic nervous system to kick in. And then when she would do her tests, she had a place to go, right, mentally, and be able to deal.
Thank you for sharing that. I think you gave such good examples of like anxiety, the waiting, the being in the hospital. I think those are great examples of like how can we support patients in those moments. Um, from your experience, how can hospitals, health systems provide mindfulness to their patients? Kathy, I know you've taught yoga and mindfulness within a cancer center. Like, what was your experience? Do you have any tips? I think we have a lot of nurses and social workers here today with us. Any best practices or advice that you can share?
Well, probably the most obvious thing is to offer it and provide basically my takeaways from working within a cancer hospital is that it allows people to find community as well. So not only are they getting practice in the moment, not only are they gaining tools to put in their toolbox to use when they're not in their practice, but they're also surrounded by other people who are supporting and encouraging them. If you have specific questions about what it looks like or how it goes down or what can I how can I help you understand like that better?
Yeah, I think we can open that question. Let's maybe like hear Kelly's
Okay.
experience in providing mindfulness within a health system. Like, how did it work? How does it work?
Sure. Yeah. And I was going to say too, along the lines of what Kathy was saying, mindfulness practice really lends well in a group setting. So I think offering groups is an excellent way to help a lot of patients. It can be done in person, it can be done virtually. So I think that's also really important, that the modality of virtual in person doesn't really matter. I've done mindfulness groups that were just over the phone even. So it's it's such a great intervention because one, everyone can benefit from it, and two, it can be delivered in kind of an easy way. So there's flexibility in the delivery. So, you don't, if you don't have, most hospitals or, medical settings don't have a whole lot of extra rooms, or extra space or offices. So having a dedicated time to have some kind of leader do a mindfulness practice, via Zoom or whatever equivalent or over the phone can be really great. So any kind of offering in that way can be awesome. And the thing with mindfulness too is that it can still be helpful if people just kind of like drop in and out. So it doesn't have to be a closed group. It's helpful. It can be helpful if it is. Again, like I said, mindfulness tends to be a muscle that you build. So, if you're kind of starting small and then building, it's helpful for people to go to multiple sessions or to kind of stick with it. But it doesn't have to be that way. So for some people who have variable schedules, if they kind of pop in when they can still benefit. So I think, doing it in a group setting is really great and just a really great way to help a lot of patients at once.
Yeah,
Yeah.
and I wanted to chime in on the virtual part too, if I could. Sometimes people don't feel very good when they're in treatment, and the whole thought of getting somewhere, another appointment can be overwhelming. And also sometimes people have their immune system is suppressed too. So it's been kind of an interesting thing to see it working virtually and maybe in some ways even making it um, more accessible.
Yeah, that
I
makes sense.
completely agree with that. Yeah, I think that it's, working with cancer patients, it's so variable. And, as providers, as a psychologist, we have a lot of flexibility in saying, okay, you're not feeling great. Well, what about doing your session from home today? That's usually something that we can accommodate. So yeah, I think utilizing the virtual space is such a really excellent tool to help with accessibility. Sometimes too, people are traveling pretty far to get their cancer treatment as well. So, if they can have appointments the same days as treatments, great. Sometimes people are not up for that. And so yes, virtual is such a great way to make mindfulness more accessible.
Thank you for sharing that. I think the virtual aspect resonates a lot with what we do at the After Cancer, because our goal is really to bring these practices virtually, make them accessible to anyone. It doesn't matter where you were treated, if your hospital has capacity to provide those sessions or not. Kelly and Kathy, before we open up for questions from the attendees, I don't know if there's anything else that you would like to share. Putting you on the spot here.
Well, I would see that as an opportunity for me to encourage people to try it and to offer it. Um, You know, there's a reason you came to this meeting today, and it would be exciting and fun to maybe give it a try with the people that you help if you want to help them in this way.
Yeah, and we will try it today. So let's open for the Q&A. Does anyone in the crowd have a question? You can write your question on the chat. You can raise your hand and then unmute yourself to share it. And after we've done the questions, we can practice mindfulness all together.
I do have a question. Hey, Kelly and Kathy, you know me. As for physical activity, sometimes it's easy to start, but it's really hard to maintain the routine. So, what are your tips for maintaining a mindfulness routine in your life?
I love that question. That's a great question. And I so especially when I am working with patients individually and I'm sitting down with them, we come up with a plan. So having a specific plan of when and where and how you are going to practice really helps keep people accountable. It also helps keep them on schedule. So for some people, they like to practice mindfulness right when they wake up in the morning. For other people, they really like doing it on their lunch break. For some people, they want to do it before bed. So at first, we might need to experiment and find out what works best for you. But with any new routine that you're building that you would like to integrate something new, it is really helpful to kind of go in with a game plan. And so choosing, having everything set up for you to be successful. For example, if you have a recorded mindfulness practice that you really like, that is, 4 minutes long, then you're going to choose what time of day you want to sit down and do that 4-minute practice. So going in, like I said, with a plan, having the practice lined up, kind of knowing what you're going to do really is helpful, and then just doing it. So what's also really helpful with that is to write it down. So whether that's, your calendar, if you have a physical calendar, I have a physical calendar, or if you're like everyone else and you use an electronic calendar, it can help to have reminders, or it can help just to have it written down to remind you to do those things. And once you do it enough, usually a couple of weeks, it becomes more routine where you have to kind of think about the plan less and more knowing that, oh, it's 8:30 a.m. It's time to do my mindfulness practice, or, my exercise, or whatever it is. So that's usually what I recommend.
Yeah, I love this question too. So, on a personal level, something that helped me with my practice and my consistency was an accountability buddy. And, after I would do my practice, simple text, I meditated, and a story, right? No, 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 like, hooray, celebration. There was no response. And likewise with my partner, right? So, accountability can be done through with a partner or with a group like we do, coming together on a regular basis helps make people be accountable. Another piece of this that I've witnessed is that it's almost a luxury to be able to sit down and say, I'm going to build a practice. A lot of the people who are in a fight or flight mode and dealing moment by moment, that sounds overwhelming and unobtainable. So a lot of the people that I work with, actually their practice comes to them in their time of need, right? We practice together, we get that accountability, we get an understanding, we get an experience, and then they have their takeaway for when they are feeling stressed out, overwhelmed, out of control. And so they can use that at those times, and those times vary, right? Another time, like Kelly mentioned, where people tend to lean in towards their tools is at bedtime, because all of the distractions of the day are gone, and your awareness is in your body and how you're feeling and the thoughts that are coming in and out of your mind. And when you are wanting to heal and feel your best, you need rest. So that's why a guided meditation was super helpful to me when I was in a treatment, and a guided relaxation and a meditation. You don't have to do anything. You listen, you respond, you check out, you check in, and you benefit. You don't even have to be fully aware in a guided meditation, believe it or not, to benefit from it. So there's the developing of a regular practice to build up your reservoir of peace and allow your body to heal. That's very beneficial, right? And then you have something from which you can draw upon in your times of crisis or your times of challenge. Any way you can get it done to get that practice going, like Kelly, like getting regular, do it. I mean, everybody's so different. And like it's creating new habits, difficult, doable. How do people get that? I mean, I can't, I think everybody has their own way. But there's my point being is sometimes, yeah, you can sit down and grit through it. You know, it's not always a pleasant thing, right? Which is another conversation. It's difficult sometimes. Or you can let it come to you. Oh, I'm overwhelmed. I'm scared. I'm in that state. And that's when you practice. So either way.
I like how you're differentiating those two things. I think one is a more proactive way of managing your stress, where
Right.
you're sitting every day and like practicing, you have that regular practice. Another one is a more reactive, but you have to have awareness to be able to do that,
Yeah.
right? You have to have awareness of something is going on. I need to practice.
Yeah. Well, one of the things though too that's so beneficial of the regular practice is then you have that place from which to draw, right? So you can prevent suffering, right?
Yeah.
If you sit down and do your 5 minutes of breathing or your guided imagery, you're preventing, right? When you're stressed out, you go up, like let's say your stress level's low and then something happens, you go up, another thing happens, you go up, another thing happens, you go up. If you start up here and something happens, you'll lose it, which is fine. We're human. But if you start low after your practice, you might be able to weather the storm a little more readily.
Yeah, 100%. We have a question here on the chat. I don't know if you want to unmute and ask it, or otherwise I can read it.
Sure, I can let you know. I was just curious. I do peer programming for teens and adults who have cancer. So I was just curious if there's like good websites or resources you would suggest if we wanted to do some mindfulness practices during our programming.
There, Kathy, over
Well,
to you.
I know a really good resource called the After Cancer.
Yes. Most definitely.
Yeah, I mean, so many out there. Okay,
Okay.
I'll just start with that. And I'm not
Yeah.
saying they're all great. I'm just
Okay.
saying there's a ton out there. So my tool, I know that there's some guided meditations out there that are very beneficial. Breathing techniques are very beneficial.
Okay.
I don't know how to answer that because there's so many options now. When I started 30 years ago, right, there were a few books, a few recordings. I will name a few things that have helped me and the people I work with. Belle Ruth Napperstack.
Okay.
She does guided relaxation and guided imagery.
Okay.
And then other breathing techniques are beneficial. I mean, I don't want to get too specific though, because there's so many other ways to do it. I feel like I'm not answering the question. How about you, Kelly?
I was also going to say, the After Cancer does have some really great mindfulness resources, and of course they're going to be cancer specific. So, of course that's something that I recommend. I am also, helping with some of the mindfulness programming, so I can certainly speak to the relevance. And it's going to be really, really great. So that's super exciting.
Awesome.
And I also, so I will say, if you Google like mindfulness exercises, it's super overwhelming. There's so much
Yes.
out there. There's a lot to choose from. So what I usually recommend is one, the VA has a lot of great resources. So Veterans Administration, they put out a lot of free stuff for everyone. You don't have to be a veteran. More of what they put out, I think, is scripts. So it might be you reading those things.
Okay.
But that's kind of a nice free resource for a lot of people. And then there are some apps. I only really use one. I know there's a lot of apps, and I'm sure there's a lot of really incredible apps. Some you have to pay for, some have the in-app purchases. So there are some things like that, but some of them are also similar to when you Google, you get a lot of hits. So I think,
Yep.
kind of narrowing down what you're looking for is sometimes helpful. So, if it's cancer specific, I think the after cancer is going to be a really good bet. If you
Perfect.
want something that is, time-based, I would search for that. So I think just knowing what you're looking for, because mindfulness resources in general is, I mean, just in my personal library, I think I have many, many books.
Yeah.
So it's really hard to narrow it down unless you know kind of specifically what you're looking for. But yeah, I can certainly, if you have more specific requests, that might be helpful to narrow it down a little bit. But
Yeah.
there's so much out there.
I also think that if you take a look at where the person learned and how long they've been doing it,
Mhm.
that's leading the meditations, that can kind of give you a feel of their experience level, no judgment. I mean,
Yeah.
there's just, I think the reason maybe that there's so many resources out there is that people are so unique in so many ways, and the way that they live and the way their brain works is that something works for this person really nicely, or they really latch on to that, and then something completely different works for another individual. So once again, I'm not answering the question, but I thought I'd say that.
No, that was the both of you. Thank you so much. It's very helpful and definitely start to get us sort of on the right track with things. So thank you. I appreciate it.
Yeah.
Yeah, I agree. Again, Kathy, there's just, a lot of options. And I think my best recommendation too is to obviously listen to any kind of recording ahead of time and do the practice and see how it feels. So there are just, and I tell this all the time to my patients too, try out this certain practice or try out this other one, see what you think. And if you are very distracted by the way someone describes something or maybe their accent or something like that, then maybe that's not the practice for you. Try to find something that you feel is a good fit for you. And it's really hard to explain what fit means unless you're doing it or listening to it. So
Yeah.
I think it's one of those things, again, you have to kind of learn by doing.
Yep. Awesome. Thank you so much. I appreciate it.
Of course.
We can try to compile a few resources and share it by email to everyone afterwards. Some of the VA resources that Kelly mentioned, maybe some recordings that we can like pre-vet. Um, I agree with what you said with the fit, Kelly, because the music behind the accent of the person, the tone of voice, sometimes can be triggering. So I think it really doesn't work for everyone. And then I think when it comes to recruiting someone to lead these sessions, if that's what you're also looking for, your peer programming, it's what Kathy mentioned. How many years of experience? Where did they learn? Do you have experience with cancer survivors? I think that's important because when you're trying to sit in silence and you have all of these thoughts, that can be very triggering. And so you need someone who knows how to deal with that if that person is getting triggered by the mindfulness. And it happens and it's normal that it happens. So having someone with experience with like talking and supporting survivors is important versus just a yoga teacher who does mindfulness classes for open to anyone. Thank you for your question. I don't know if there's any other questions in in the audience. Otherwise, we can go and maybe practice a few minutes of mindfulness.
Hey, I wanted to follow up with what you said if I could.
Yeah.
Yeah, so the mindfulness groups, there's something that can happen, which is people can be triggered, right? Other times you see people having a release, right? So those are two different emotional and physical experiences. And both can be part of the practice, and the ability to allow a releasing or emotions or feelings or body movement. That's something that is, like you said, common and part of the practice. Somebody who is triggered and overwhelmed is having perhaps a different experience, and there's a safe space to recognize and acknowledge that too. So I just kind of want people to not feel like you just to have that known, right? That's okay, and it's common, and of course it can be part of the experience.
Yeah. Yeah. And release too, and release can come in so many formats.
That's right. Yeah.
Love that. So, no more questions. I suppose if anyone has a question that comes to your mind, write it on the chat. We'll look at it. Before we go on the to practice, I just wanted to share the topic of the next session. So the next session is going to be on September 24th at 1 p.m. ET. And we're going to cover the role of therapy in different phases of cancer survivorship. So we're going to have a therapist, and then we're going to have a patient advocate who advocates a lot for like therapy and access to psycho-oncology. So we'll go through their experiences and share. So you can read this QR code. I am going to drop off the link on the chats too. And then Kathy, over to you. Let's
Okay.
practice mindfulness.
All right. So today I thought I would share something called calming the body, right? So when we get agitated and overwhelmed, our body gets tight and we hold and we get tense. And likewise, when we calm the mind, the body can become calm as well. So today we're going to practice something called calming the body so that we can calm the mind. And it's a guided meditation based in the body. And I'll lead you through it. Let's give it a go. So as you're ready, go ahead and find a place where you can be comfortable. Maybe you lean back a little bit in your chair and rest your arms on your chair. Begin to assemble the body in a way that you can be supported. If it works for you, you can close your eyes. You can lower your gaze. And take a few breaths here and begin to hand the weight of the body over to your chair. Feel your feet on the ground. Maybe you map out the shape of your feet, where they're touching your shoes or the floor. Feel the places that your body is touching your chair. And then place your awareness on your breath. And in your own timing, in your own way, go ahead and take 3 smooth, deep, rich breaths. Taking time to inhale. Taking time to exhale, letting go. Your breath can usher you into this present time experience. Feel your body breathe. Beginning with the left arm. As you breathe in, picture the arm filling with the energy of the breath. And as you breathe out, imagine pushing this energy out through your fingertips. Tune in to the left arm as you do this, keeping both the physical body and the visualization in your awareness. Inhale, the left arm expands. And as you exhale, clearing out through the fingertips. Continue. And if the mind wanders off into thought, gently bring it back. Bring it back to the left arm and the practice. And now let go of the left arm and place your awareness on the right arm. Maybe you can fill out the whole arm with your awareness from shoulder to fingers. And as you breathe in, fill in the arm with the breath, the energy of the breath. And as you exhale, release through the fingertips. Right arm only, filling and expanding, emptying and clearing. You may notice the arm getting heavier as you relax. So hand the weight over of the arm to the supporting surface. And clear out one more time with your exhale. Shift your awareness now to your torso. Visualize filling the entire chest and abdomen with breath, the front body expanding as you inhale. And as you exhale, push the breath down and out through the bottom of the spine or the tailbone. So as you breathe here, envision expanding in the front body as you receive the breath. And allow the breath energy to move out and down. It's in the nature of the mind to wander. And when it does, gently and lovingly bring it back. Think of it as a homecoming instead of a shortcoming. Back to sensation, inhaling to expand in the front. And handing it all over with the exhale. One more time. And now place your awareness on the left leg. As you inhale, visualize the leg expanding, filling. And as you exhale, push the breath out and down through the sole of your foot. Left leg only. clearing out tension. One exhale at a time. Energizing. One inhale at a time. And now switching to the right leg. Continue with your practice. Expanding as you inhale, the whole leg. And as you exhale, pushing down and out to the sole of the foot. Stay with the breath and the visualization the best you can. A real treat for the mind and the body. A well-deserved break. One more exhale, letting go, finishing with the right leg. And now try to put it all together. Breathe in and fill your entire body with breath. Expand your awareness to the whole body if you can, filling. And as you exhale, breathe out through the fingertips, base of the spine, and the feet. Expanding on the inhale, receiving. Softening on the exhale, clearing out and letting go. Staying with the practice the best that you can. Coming back as many times as you need to. Your inhales can be energizing and encouraging. And your exhales can be calming and reassuring. Three more rounds of breath in your own timing and your own way. Inviting relaxation to the whole body. After your 3 breaths, orient yourself again. Feel yourself in your chair. Feel the support of the chair. Feel your feet on the ground. Feel the ground with your feet. And when it's time to open your eyes, open them with a lowered gaze. Slowly rejoining. Blink the eyes a few times. And when you're ready, lift the face, bright eyes, shiny eyes. And that's our practice for today. Thanks for practicing.